mic. I don't want him to hear that.
They broadcast it, but they missed that part.
Good. Let's start off this meeting with a salute to the flag, followed by a moment of silence, prayer, and meditation, and thanks. Chief.
All right, please join me in showing honor to this great nation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
A moment of prayer, silence, and meditation. Thank you. Roll call. Jeff. Damn. Just kidding, GK. I was only kidding if you hear anything. Jeff.
Yes, sir. Thank you. Mr. Gleason.
Here.
Chief Shoemaker.
Here.
James Miller.
Here.
Mr. Cryer.
Here.
Mr. Peters.
Here.
John Surface.
Here.
Dr. Lyon.
Here.
Dr. Canson.
Here.
And Chief. Welcome aboard. We do have a quorum.
Once a chief, always a chief, right?
Yeah, that's it.
No matter what he does. Okay, the consent agenda, please consider your agendas. Everybody got a copy? Okay, good. All items listed with CA are considered by division staff to be routine and non-controversial. Consent items may be considered first and approved in one motion if no member of the board or audience wishes to comment or discuss an item. If comment or discussion is desired, the item will be removed from consent and heard in listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. We have one item on the consent agenda, and that's the approval of the minutes of MCAB meeting August 8th, 2019. Anyone in the public wishing to make a comment? Bring it back to the board.
Motion approved.
Second.
All in favor? Aye. Any opposed? Okay, moving over to subcommittee reports. We have none. Public comments. This portion of the meeting is reserved for persons desiring to address the board on any matter not on this agenda and over which the board has jurisdiction. Members of the public will also have the opportunity to comment as agenda items are discussed. Any member of the public wishing to make comment before the board today? Seeing none, I will bring it back to the board and ask for I guess we have no motion on that. Public requests, we have none. Unfinished business, we have none. New business, we have a list of things on new business, and what I'm going to ask to do is pass it over to Jess to outline some changes we've made in the listed items for new business.
Thank you, Mr. Chairman. Real briefly, I just need to pull item 10B off of the agenda today. There's a required change to that policy, and once that change is made, it will have to go back open for another public comment period, so it will be brought back to this board at our next meeting. Additionally, in the original agenda that went out with your packet, G, E, and D policy was missing. So that I handed out an updated agenda that has that on it. You had the policy, you just didn't have it on the agenda. So I've printed out and handed out that. So those are the only changes, Mr. Chairman.
Thank you, Jeff. Appreciate it. So let's begin on new business 10A, the Maddie Fund Quarterly Report. Jeff, any discussion?
Yes. Real briefly, I'm sorry, Mr. Chairman. Before we do that, I would like to introduce new members to the board. That slipped my mind, I'm sorry. But the new sitting member for the Fire Chiefs Association is Deputy Chief Stephen Shoemaker. Welcome. And the alternate in that spot for the Fire Chiefs Association is Deputy Chief Trevor Martinezson from Bakersfield City Fire. And we have another surprise new member today. Welcome aboard, sir. Did you want to say anything while you're give us an introduction?
Okay. Sure. Representing the Kern County Chiefs Law Enforcement Association, Chief Lyle Martin from the Kern County District Attorney's Office.
Welcome aboard. Okay, moving on to the Maddie Fund. As you can see, I will probably be moving this report to the consent agenda from here on out because we're just looking at numbers and they're pretty easy to to read and figure out. The carryover, there's 2 columns now because we had a carryover from last year. Remember that the Mattie Fund has been set aside for the public, or anyone for that matter, to make recommendations to us that will better the EMS system. So that's why we have a large amount sitting in this account right now. So the total right now is $248,718.77. That still does not reflect the monies for hand heavy that was approved by this board. It's going back to the Board of Supervisors the end of this month. Then the monies for that will be taken out of this account. What's the total? It's 33,000 and change.
Okay, anybody in the public have a comment on the Mattie Fund report? Seeing none, I'll bring it back to the board. We need a motion or a discussion to receive and file. We have a motion. Looking for a second.
Second.
All in favor, say aye. Aye. Opposed? Seeing none, we'll move to item C, STEMI policy update.
Thank you,
Mr.
Mr. Chairman. STEMI, which means S-wave, T-wave segment elevation myocardial infarction, is an acronym for a program designed to get patients suffering from a particular type of cardiac event to a cardiac catheterization laboratory as soon as possible. The process begins with paramedics in the field sending 12-lead ECG telemetry or verbally relaying the ECG results to a STEMI receiving center, which is a specialty designation center. A confirmed STEMI activates an internal hospital process to rapidly diagnose and treat the patient. A few minutes saved in getting the patient to the catheterization laboratory can make a significant difference in the patient's outcome. The STEMI system of care policy was originally approved by MCAB at the May 2012 meeting and formally adopted by the Board of Supervisors on June 12, 2012, and it was last updated in 2013. In the 6 years since the last update to this policy, there have been numerous issues that have arisen within the STEMI system of care. Changes have occurred to the system, and requirements have been mandated by the state. The current policy was outdated and needed updating. Over more than a year, EMS worked with STEMI Quality Improvement Committee to review, make corrections, and update this very important policy. Each member of the committee provided input for the update. Additionally, the state mandated changes were merged into the policy. This updated policy now reflects lessons learned since the inception of the system of care that extends the catchment area for direct transport to STEMI receiving centers, as well as consolidation of language, streamlining of the hospital accreditation process, clarification of on-call status of cardiologists, updates for performance standards for SRCs, STEMI receiving centers, as well as updated definitions. Therefore, it is recommended that the board approve the updates to the STEMI system of care policy.
Thank you, Mr. Sessions, appreciate it. Let's open it to the public and hear your thoughts. People have any thoughts on item number 10C, STEMI program? Seeing none, we'll close it, bring it back to the board for comment and a vote. I'll give it 15 more seconds. And then it dies.
So are we voting to see the file or to approve?
We are voting to
Approve.
Motion approved.
We have a motion and a second. All in favor, say aye. Aye. Opposed? 10 Delta, Kern inappropriate user policy. Jeff.
Thank you, Mr. Chairman. It is the responsibility of emergency medical services to respond to requests for assistance and provide treatment and transport to local hospitals. In Kern County, EMS responds to over 100,000 requests for assistance each year, and these numbers have been steadily increasing. Our local hospital emergency rooms receive the patients transported by our 3 ambulance providers, as well as hundreds of thousands of walk-in patients each year. In 2018, our ambulance providers transported 78,032 patients to local hospitals. Over time, the 911 system has taken the place of the primary care physician for many people. Thousands of 911 calls are received each year for minor issues that could easily be handled with over-the-counter medications, a visit to their primary care physician, or in some cases, a warm bed and a hot meal. We have seen a steady increase of inappropriate use of the 911 system, and it is having a direct impact on our fire first responders, ambulance companies, and hospitals. These patients pull both fire and ambulance resources away from those individuals that are truly in need of help and are taking up bed space in our local emergency rooms, increasing the ER congestion and adding to the ambulance offload delays we are seeing system-wide. In response to these issues, EMS has developed a policy to assist with increasing misuse of the 911 system. This policy was developed in cooperation with Public Health Nursing, Kern County Behavioral Health, Kern County Department of Human Services, Bakersfield Police Department, and the Kern County Sheriff's Office. The Kern EMS Inappropriate User Policy was created to provide inappropriate users with resources to assist in getting them the help they need without transport to the hospital. I believe that this policy will help diminish unnecessary transports, which will result in more fire and ambulance availability and fewer beds being taken up in our emergency departments. Therefore, it is recommended that the board approves the Kern EMS Inappropriate User Policy and set an effective date of March 1st, 2020.
Thank you, Mr. Ferris. Let's open it for the public. Any thoughts? Seeing none, we'll close it and bring it back to the board for a comment, a vote.
Mr. Chair, I would just add, we live through this every day, and I'm going to give you a couple of quick numbers. We track our frequent users, not by name, but by an ID number. User number 17, we responded and transported him 34 times since the first of the year. Number 16, we've transported 16 times. Number 18, 13 times. In total, this year, so far there are 8 people that will qualify under the new policy. And with that, I would make a motion to approve.
Thank you, Mr. Service. Second. We have a motion and a second. All in favor, say aye.
Wait.
Aye. Opposed?
Discussion.
Oh, there's more discussion? I'm sorry, go ahead.
I'm sorry, I had a question about it, because I read through it. With this policy, doesn't mean that if someone calls 911 and they're a frequent user, that someone would not come out to evaluate them. Everyone who calls would still be evaluated.
Correct.
And still there's an evaluation, and then if it's deemed appropriate, the individual would not be transported, to the ER. Is this expected to save money, or is it just about saving the resources of not having the ambulances go out? And do we know, what's the expectation on how much either time or money is expected to be saved by this policy?
Well, I had Hall Ambulance run some data for me. So to give you some idea, for the calendar year 2018 alone, there was a total transports of 27,699 of multiple users of the system. That included 170 patients in that year that were transported greater than 15 times. 124 that were transported 10 to 14 times, and so on. So you see where it's actually having an effect on both sides of what you stated. It's going to save money for the providers, but it's also going to save bed space for the hospitals, which could have an effect on the ambulance turnaround times that we're seeing. So it's kind of a domino effect, is my belief. And to answer your question, yes, absolutely. Every 911 call gets a response and a complete and thorough evaluation.
I'm sorry, one other question. Is this implemented anywhere else, or are we the first place?
Yes, actually, it's been ongoing in the county just north of us for more than 7 years.
Okay, and they're satisfied with it?
Yes.
Okay.
Any more discussion? I'm sorry to
No, it's all right.
preempt you on that one. Okay, we have a motion, we have a second. All in favor, say aye.
Aye.
Aye. Any opposed? This Let's move on to ECHO, 2019 EMS plan. Mr. Farris.
Thank you, Mr. Chairman. California Health and Safety Code mandates that local EMS agencies submit an annual EMS plan to the State Emergency Medical Services Authority, or EMSA. EMSA will then determine if the plan effectively meets the needs of the people served and conforms to the applicated guidelines and regulations. The EMS plan provides a specific evaluation of how the system currently meets the state's EMS system standards. It identifies system needs and provides a mechanism for planning of activities necessary to reach compliance with state standards if necessary. It provides information on all aspects of our system, including all providers, hospitals, and ambulance zones. The 2019 Kern County EMS plan meets or exceeds all health and safety code and EMSA standards and requirements, and was submitted to the state on December 11th, 2019. I had supplied you all with a separate document in the email that was the plan for you to look over at your leisure. Therefore, it is recommended that the board receive and file the 2019 Kern County EMS plan.
Thank you, Mr. Farris. Any questions from people? I got one. A dumb question from someone who doesn't know, but a plan implies something we're going to do. This is obviously something that we've done.
It's
we're
a
not
little
late
bit,
on this.
it's a
This
little
is
bit of
normal.
both. We're not late on it, no.
Okay.
It was actually filed on time and early, actually, but I've been in contact with the state on numerous occasions since then, and I'm expecting to get an approval from them any day.
Okay, thanks. Any other thoughts from board members? We're looking for a vote.
Second.
We have a motion and a second. All in favor, say aye. Aye. Any opposed? Okay, ambulance patient offload times, Mr. Ferris.
Thank you, Mr. Chairman. Ambulance patient offload times, or APOT, is defined as the time interval between the arrival of an ambulance patient at an emergency department, ED, and the time the patient is transferred to the ED gurney, bed, chair, or other acceptable location, and the emergency department assumes the responsibility for care of the patient. The standard methodology that was created includes two separate indicators. APOT 1 reports the 90th percentile of offload times for the total number of ambulance patients received by the hospital during a specified time frame. And APOT 2 reports the percentage of ambulance patients received by the hospital and offloaded at specific time intervals. For example, 20 minutes is equal to 2.1 on the scale, 21 to 60 minutes equals 2.2 on the scale, 61 to 120 minutes is 2.3 on the scale, 121 to 180 minutes is 2.4 on the scale, and greater than 180 minutes is 2.5 on the scale. Beginning July 1st, 2019, Health and Safety Code Section 1797.225 required that local EMS agencies transmit APOT data to the EMS authority on a quarterly basis. The first report to EMSA was due on November 1st for quarter 3 of 2019, and that was submitted. Once the data is received, EMSA is mandated to submit it to the state legislature for review. Ambulance patient offload times are extremely important and can have a direct effect on the 911 system. Included in the packet that I provided to you are APOT numbers for quarters 3 and 4 of 2019 for your review. Therefore, it is recommended that the board receive and file the APOT report.
Thank you, Mr. Ferris. Anyone in the public? You guys aren't saying much today. Maybe that's a good thing. Bring it
Mr.
back to-
Chairman?
Yes.
One inquiry for Mr. Ferris. The data that you supplied in any of the action that you are requesting today, does it involve Ridgecrest Regional Hospital?
Yes. Back page.
I don't believe so.
Well, I think on the second page it's listed.
Oh, the second page has Ridgecrest numbers on it.
Yeah, my information is that, I think, Mr. Chairman, your wife works for Ridgecrest Regional Hospital. There's no financial interest here. Just for purposes of voting, what's the action item? You're just asking to receive and file?
Receive and file.
Right.
It's not a
there's-
vote.
Yeah, so
Yes.
there's no conflict.
Thank you, GK, I didn't think of that.
No problem.
And she's a brilliant nurse, too, by the
I
way.
understand that was your
I'll
staff member
tell you
who
sent
pointed
that,
that
I'll
out.
tell you sent it.
I'm glad I'm not fired as well.
Okay, the public already did not offer a comment. Bring it back to the board. GK, thank you very much. Any other board members with thoughts or a vote, please?
Just a question for Mr. Ferris. Is there any movement in the legislature to do anything with this data to try to address this issue?
Not to my knowledge at this time. They are currently in the collection process.
Okay, thank you.
Mr. Chair,
Mr. Service.
so, this is an item that's near and dear to my heart, right?
I was told.
Yeah, so yesterday, just to give you an example, 26 times ambulances in Bakersfield offloaded or delayed more than an hour. 8 times, 2 hours, and 3 times, 3 hours or more get offloaded. I don't know that.
John, can you turn your mic on?
Sorry. I told the new guy, hey, before you talk, make sure you push the button, so I apologize, right? So, the APOT 1 and APOT 2 numbers really are a data collection point to try and prepare IMSA to get their head around what's going on statewide. It doesn't tell the whole story. I think that we're at the point in our county where there needs to be a referral, whether it comes from this board or from the Board of Supervisors, back to the department to do a more in-depth research and report back what's really going on. I don't know whether we do that in the form of a motion or whether you do that as a referral through the Board of Supervisors. I don't know how to do that.
Okay, GK, is that your done with your question?
Yes, sir.
Sure, second. My son works for Hall Ambulance. He has no financial relationship with me whatsoever. He doesn't live at our home. He lives up in Tehachapi. Can I still talk about this stuff?
Yes, you can talk about it.
Thank you,
And
appreciate it.
it's, since the action item is just a receive and file, you may vote on it as well.
Okay, great, outstanding. So your question, John, was how do we move forward in making sure we assert ourselves in trying to better understand this problem?
Correct. APOT 1 and APOT 2 don't tell the whole story. There's a lot of data there that needs to be looked at, and I don't know whether this is the right board to ask the department to do that, or whether your board has to do that, but I
Yeah.
think the request needs to be made so we can get started. And it's not gonna be a 1 month or a 2 month study. It's gonna take a while to understand. There's a lot of moving parts here, and it's not one, there's no silver bullet, by the way, that's gonna fix the problem. There is no medicine, and it's not gonna be fixed tomorrow or a month from now. But I think that it's at the point in this county where we need to start talking about it.
So I don't have an answer to that question. So I refer right back to you. What do you think is what do you think is a way to go about asking that question or moving forward?
Well, if this board can make a recommendation back to the department, then I think that would be the way to do it.
Okay, so I think that might be a good idea. Let's let the MCAB folks, emergency medical, figure out how we're gonna take advantage of this opportunity that's presented and achieve some type of, just some satisfaction from the question, the answers that are being delivered, and how we best move forward. So Jeff, let's do that. Let's ask you what your thoughts are on how do we shape this motion that we're about to make, if that's agreeable to the
Well,
board.
Yeah, I believe he's asking for the board to recommend that the department do an in-depth study of this situation.
Correct.
And that's perfectly fine with me. I think we've already planned on starting that process.
GK, would that be a separate motion from the one we're about to make?
Yes,
Because right now, we're making a motion to receive and file.
correct,
Then we're gonna make one motion, and then we're gonna make a second motion.
correct, which would be a referral to the department to further investigate ambulance offload times for report back to this board.
Can I vote on both those motions? That doesn't matter, I think it's,
I think the first one you can vote on, I would recommend, just out of the appearance, that you not vote on the second one.
so John, having two motions here, one is gonna be a receive and file.
Correct.
The second one is going to be a referral that you make, and then
Correct.
we'll vote separately on that. Is that okay? Is
Motion
that
to receive and
okay?
file.
We got a motion to receive and file. We have a second, also, what do you guys think? Yes, all players saying yes, say yes. I'm not-
All in favor?
All in favor, all in favor. Yes, don't ever get old.
Aye.
All in favor, aye? Any opposed? The second motion is going to be for a referral from John to the department to receive, collect, would you shape that referral, John, for us, please?
to do a deeper review of ambulance offload times that exceeds APOT 1 and APOT 2.
So I'm going to abstain from that. Can I call for the motion?
I would have someone else call for the motion.
Okay. I'm going to have the chief call for that motion. Any public comment on the referral? Thank you, we don't need it. Chief, would you call for a motion on the referral, please?
None called for the motion for the referral to dive deeper into the data outside of APOT 1
Yeah.
and APOT 2.
I'd make that motion. Yeah.
Have a motion? Have a second? Have a second? All in favor?
Aye.
Any opposed? Abstention?
Thank you, chief. Where are we now? Number G, letter G, EMD policy update, Mr. Ferris.
Thank you, Mr. Chairman. Emergency medical dispatch, or EMD, policies and procedures define the requirements for the EMD scope of practice, training, certification, recertification, providers, and operational requirements within the county of Kern. The EMD policy has been in effect for many years and was last updated in 2016. That revision added OCD as a single ambulance dispatch center for the county, further defined scope of practice, and added a mutual aid request section. Since this update, EMS has experienced multiple changes that required another update to the policy. As a result, Kern County EMS has updated the EMD policy to align with the changes that have occurred in our system. Changes include updating terminology, additions of the duty officer program, and updates on the EMS contact list. Therefore, it is recommended that the board approve the updates to the EMD policy.
Thank you, Mr. Ferris. Public? Back to the board for comment or a motion. We have a motion? Second. And a second. All in favor say aye. Aye. Opposed? H, proposed dates for 2020 vote.
Thank you, Mr. Chairman. This was supposed to be done last year, but we didn't have a quorum and we didn't have a chance to vote on it, so here we are on February 13th. The proposed dates continuing throughout the year are May 14th, August 13th, and November 12th. The agenda deadline for each of the 4 meetings, if the board approves this schedule, would be a Thursday 14 days before the meeting itself. It's recommended that the board approves the 2020 MCAB meeting dates.
Thank you, Mr. Ferris. We're going to go to the public. So bring it back to the board for a vote on whether or not we should meet today. I'm looking for some discussion and a motion.
So moved.
We have a motion and a second. All in favor say aye. Aye. Opposed? Thank God. India, accreditation policy update, Mr. Ferris.
Thank you, Mr. Chairman. Pulse Point is an app for Android and Apple smartphones that alerts nearby citizens of the need for CPR when a person within 1/4 mile goes into sudden cardiac arrest in a public place. Users of the app indicate they are trained in CPR, meaning that they, at the very least, have hands-only CPR training, and they accept the option to receive push notifications from Pulse Point. Pulse Point, through active citizen responders, has been shown to improve cardiac arrest survival rates. Pulse Point Verified Responder is an extension of Pulse Point and allows professional caregivers to respond if within 1/2 mile to numerous extremely sensitive medical emergencies, such as cardiac arrest, obstructed airway, drowning, or drug overdose, in public and private places. Where the majority of sudden death occurs is in the home. To become a verified responder, an individual must complete a short application providing a medical license number, such as an EMT, paramedic, nurse, or physician, in good standing and verifiable with the state of California. It is the responsibility of Kern County EMS to assure that all verified responders operating within the county maintain their medical license in good standing. All locally accredited paramedics, mobile intensive care nurses, emergency medical dispatchers, and emergency medical technicians must have a live scan, providing a method for EMS to monitor their licenses on an ongoing basis. Currently, EMS has no method for monitoring the medical licenses of other medical professionals not locally accredited who may desire to become a verified responder. EMS has updated the accreditation of EMS personnel policy to include verified responder as a local accreditation within the county. As a result, it will now be mandatory for any individual applying for verified responder to obtain a live scan, allowing EMS to monitor their license. Since its initiation in Kern County in 2019, my staff alone, to give you some idea of how this works, my staff alone have responded to more than 6 cardiac arrests. On January 21st, I myself responded to a reported cardiac arrest to a residence in the city of Taft. I was first on scene, provided an assessment, gathered information, and cared for the victim until the on-duty fire first responders and ambulance arrived. Verified responder is a very important tool in treating time-sensitive emergencies in our communities. Therefore, it is recommended that the board approves the revised accreditation of EMS personnel policy and set an effective date of March 1st, 2020.
Thank you, Mr. Ferris. Anyone in the public? Bring it back to the board for comment and a vote.
Motion to approve. Second.
Give a motion a second. All in favor, say aye. Aye. Any opposed? Item J, special event policy. Mr. Ferris.
Thank you, Mr. Chairman. Kern County hosts numerous special events throughout each year that attract tens of thousands of individuals. Events such as Lightning in a Bottle that brought in 18,000 visitors last year and is expected to almost double that number in 2020. 2019's Wasteland Weekend attracted 4,000 to 5,000 individuals, and Utopia another 1,000. Kern County plays host to numerous other events each year that attract even more individuals. It is the responsibility of Kern County EMS to assure that all residents and visitors have access to pre-hospital emergency health care in an efficient and timely manner. Large gatherings and/or special events are no exception, and in many cases increase the risk of illness or injury to its attendees. In an effort to assure the residents and visitors to these large events received the most efficient and timely care, EMS has created the special event policy. This policy establishes minimum standards for emergency medical services at public gatherings and special events. It assures that EMS is involved from the beginning in the planning and implementation of these events. Additionally, the policy provides for EMS oversight at the events to assure the proper care is being delivered by the event staff. This policy is vital in assuring the safety and care for all who attend events in Kern County. Therefore, it is recommended that the board approves the special event policy and set an effective date of March 1st, 2020.
Thank you, Mr. Ferris. Anyone in the public? Bring it back to the board for a comment and a vote. We have a motion.
Second.
We have a second. All in favor, say aye. Aye. Any opposed? Item 11, Manager's Report. Mr. Ferris.
Thank you, Mr. Chairman. The past months have been very busy for EMS. In reviewing the events that occurred during the earthquakes in Ridgecrest, we identified several gaps in our EMS system. EMS is the designated Medical Health Operational Area Coordinator, or MOAC, for Kern County under the state's Medical and Health Disaster Emergency Preparedness Programs. The core mission of the MOAC program is to assess immediately upon notification any emergency and/or disaster occurring within the county, to assist responders in managing the emergency, determine and diminish the impact on the EMS system, determine the need for and rapidly request additional resources, whether from in or out of county, coordinate with all emergency responders to rapidly transport patients to the closest, most appropriate hospitals, and to be the conduit for all medical and public health resources for the affected entities. The first gap identified involved communication, more specifically, differences in terminology. Several misunderstandings occurred between Kern County EMS and the entities affected by the earthquake. As a result of these misunderstandings, EMS has created a MOOC training program, and I've been visiting each Kern County hospital in an effort to assure that we are all speaking the same language and have a complete understanding of the MOOC program. The second gap noted involved information gathering. While we have had an EMS on-call program for many years, we did not have a system that would allow for the response of EMS staff to the scene of the earthquakes in order to collect firsthand information and provide support for the MOOC program. Because of this gap, we were receiving information from several different sources that did not always match, and we were forced to make decisions based on these pieces of information. As a result, EMS has added a duty officer designation to our on-call program. Duty officers are equipped with an emergency response vehicle and will be responding to the scene of large-scale events in order to provide for first-hand information gathering, coordination with hospitals, ambulance providers, first responders, the Department Operations Center, the Kern County Emergency Operations Center, the Governor's Office of Emergency Services, and our regional partners. Additionally, duty officers may be required to transport and deliver medical supplies, medications, or items from the county's ChemPAC to the scene of an event. These duties will be carried out along with and in addition to the day-to-day management and oversight of the Kern County EMS system. We have acquired a vehicle, as I stated, an F-150 pickup truck, and have begun the process of converting it to emergency response vehicle. We expect it back from the shop actually next week, hopefully. In addition, Kern County Public Health has begun the process of building a mobile command post. Once completed, the mobile command post will allow Kern County EMS to move our Department Operations Center to the scene of disasters such as the earthquakes, providing opportunity to operate in conjunction with fire, law, and environmental health in order to obtain the most accurate and up-to-date information. While the duty officer response vehicle is operational, at this time we hope to have the mobile command post operational by early 2021. We have remained committed to providing education and training throughout the community. Since our last meeting, EMS has provided hands-only CPR and stop-the-bleed training to more than 500 community members and over 100 first responders at the EMS for Children's Educational Forum. In addition, we provided triage training to the medical staff at Kern Valley State Prison. In an attempt to increase the training for our community, we have added a training request form to our website. Now scheduling a training is as easy as completing the form, clicking submit, and that's it. The form gets submitted and sent to one of the EMS coordinators. They will reach out to the individual who completed the form and schedule the training. We have continued our commitment to quality improvement and have reviewed more than 1,000 patient care reports for compliance with policy, procedures, and protocols. Additionally, we have combined the Kern County Steering Committee, initially created to review the Bravo code changes that we went through, and the Cardiac Arrest Working Group, and now named it the Emergency Medical Services Response Committee. This committee meets every other month just before the system collaborative meetings and reviews and discusses all cardiac arrests as well as aspects of field response. We have developed a grading system for reviewing patient care reports. This procedure is currently on our website, open for public comment. Once in place, EMS will begin reviewing and grading patient care records each week and scoring each based on 4 specific elements: the narrative portion, treatment, transport, and special criteria such as core measure compliance. The crew member, along with their employer, will receive an email with their grade immediately following the review of their patient care report, and each month EMS will post a grade for each agency or employer based on the average of their employee scores that were reviewed the previous month. It is our desire to assist our provider agencies as well as our field crews to strive to be the very best that they can be. Since the Lightning in a Bottle event in May, EMS has approved the medical plans and overseen numerous other events. We approved the medical plan and provided on-scene oversight of Wasteland Weekend, September 26th through the 28th. This is described as a real-life Mad Max. Wasteland Weekend is a post-apocalyptic music and arts festival that requires all of its attendees to be in full costume in order to create a full immersion effect, making festival goers feel like they are inside of a Mad Max-style movie. Next, we approved the plan and provided oversight at Utopia. Utopia is a Burning Man regional event celebrating the culture and principles of the Burning Man. Burning Man is an experiment in temporary community dedicated to anti-consumerism and self-expression. These annual events traditionally last several days and culminate with the burning of a large wooden sculpture. This event occurred in the North Edwards area of the East Kern on October 25th and 26th. On the same weekend as Utopia, EMS provided oversight at the Spartan SoCal Ultra Beast and Sprint event in the Tejon Ranch. This event is made up of 3 different races, each designed to test the most fit athletes. During each of these events, EMS was welcomed by the promoters and participants and repeatedly told that our presence brought a great deal of relief and reassurance for their health and safety. A publication from the Foundation for Behavioral Health revealed that first responders are more likely to die by suicide than in the line of duty. This scary fact historically has been related to a lack of attention directed to first responders' mental health. The culture among first responders for decades has been that silence equals strength. This misguided belief is the driving factor in the elevated suicide rates among first responders. As a result of these studies and the recent response of Kern County Behavioral Health to the town of Paradise to provide psychological first aid to the Paradise Police Department, Kern County Public Health Emergency Medical Services hosted a mental health symposium that focused on overcoming post-traumatic stress disorder. On October 22nd, 2019, over 300 firefighters, EMTs, paramedics, law enforcement officers, and behavioral health representatives attended our inaugural event. Attendees heard from 4 guest speakers who shared different aspects of PTSD and provided specific ways for coping with job-related stress. Additionally, the Kern County Behavioral Health Critical Incident Stress Management Team was present and provided an area for first responders to reach out for assistance with PTSD. More than 20 individuals reached out that day, and more than 100 individuals have contacted behavioral health since that time. Those individuals all attended that symposium. This event was a huge success. We have already secured Valley Bible Fellowship for the 2020 event, which will be held on Saturday, October 10th. The official planning meetings have begun, and we are hoping to double our attendance this year. We are actively seeking partners to assist us with this very important event. As we moved into the new year, EMS has completed the purchase and implementation of ImageTrend's licensing management system. This purchase marks a move away from the paper system that has been in place for many years and brings Kern County EMS into the 21st century. All of our local EMT, paramedic, mobile intensive care nurses, and emergency medical dispatchers are now able to complete the certification process over the internet. This is a huge step forward for EMS, and this software will allow us to set automatic monitoring of all certifications and accreditations in our system, freeing up valuable staff time for other projects. Additionally, ImageTrend is working on building us an elite EPCR system that will replace our current data repository. This system is user-friendly, cost-effective, and customizable, and once the build is complete, EMS will be able to offer it at no cost to all of our EMS providers. And finally, I know you're all taking a deep breath right now. And finally, beginning today, I will be adding a section to the manager's report on regulatory compliance. This will include violations of the ambulance ordinance, policies, procedures, protocols, response times by providers, hospital designation policies and procedures, and any violation of health and safety code, California Code of Regulations, as well as Emergency Medical Service Authority mandates. So to begin this report, I'm going to go through, actually, because of the timing on this, this report will be for the year of 2019. From here on out, it will be for the previous quarter. In 2019, Delano Ambulance Service had the following compliance issues. In the months of July, August, September, and October, Delano Ambulance Service was found to be out of compliance with the Cardiac Arrest Registry to Enhance Survival, or CARES, data reporting mandate approved by this board on May 9th of last year. In August, Delano was found to be out of compliance with response times in EOA 3 in one zone. On November 13th, EMS conducted a review of cardiac arrest calls run in EOA 3 from August 1st through November 12th. EMS discovered that a large percentage of these calls were out of compliance with county policy. Additionally, on November 13th, EMS received information that Delano Ambulance Service was not in compliance with the Kern County STEMI policy. Specifically, they were not able to transmit their EKG data to STEMI receiving facilities. Hall Ambulance Service. In January, Hall Ambulance was out of compliance on 8 separate occasions, covering all EOAs except EOA 11. In February, they were out of compliance on 9 separate occasions, covering all EOAs except EOA 1. In March, they were out of compliance on 9 separate occasions, covering all EOAs except EOA 9. In April, they were out of compliance on 8 separate occasions, covering all EOAs except EOA 9. In May, they were out of compliance on 11 separate occasions, covering all EOAs except EOA 11. In June, they were out of compliance on 11 separate occasions, covering all EOAs except EOA 1. In July, they were out of compliance on 7 separate occasions, covering EOAs 1, 4, and 9. In August, they were out of compliance on 3 separate occasions in EOAs 4, 8, and 9. In September, they were out of compliance on 6 separate occasions in EOAs 4 and 8. In October, they were out of compliance on 7 separate occasions in EOAs 2, 4, 8, and 11. In November, they were out of compliance on 15 separate occasions in all EOAs except 1. In December, they were out of compliance on 18 separate occasions in EOAs 4, 8, 9, and 11. In total, Hall Ambulance Service was out of compliance with response time standards on 112 separate occasions. Liberty Ambulance Service. In January, Liberty was found to be out of compliance with response time standards in EOA 6 in one zone. On November 14th, EMS conducted an audit of all cardiac arrest calls run by Liberty Ambulance Service in EOA 6 and 7 from August 1st through November 14th. The audit revealed that Liberty Ambulance Service had completed 31 cardiac arrest calls, and 100% of these calls were run in compliance and according to policy. As a result, Liberty Ambulance Service received a letter of commendation for their outstanding work. In December, Liberty Ambulance was found to be out of compliance with response time standards in EOA 6 in one zone. In December, EMS discovered that all service providers were found to be out of compliance by failing to comply with specific data element usage as mandated by the state of California. In January, EMS received notification from the Emergency Medical Services Authority that all Kern County service providers' data vendors had failed to comply with a state mandate to recertify with the National EMS Information Systems, or NEMSIS. As a result, as of January 1st, the state shut down all data uploads from Kern County to the state database. This has placed all service providers in violation of Health and Safety Code 1797.227, which mandates that all providers submit data that meets all local, state, and federal requirements. In response to each of these reported violations, EMS sent notices of noncompliance mandating that each issue be immediately addressed. Each letter mandated a response from the provider outlining how they were going to correct each of these issues. In addition, the following fines were imposed as provided for in the Kern County Ambulance Ordinance. Delano Ambulance Service received fines totaling $4,251.20. Hall Ambulance Service received fines totaling $62,969.60. And Liberty Ambulance received fines totaling $4,165.60. Pro Safety, a rescue service provider in the county, received fines totaling $2,032. It is our hope that by reporting this information, we can work together to improve our system and provide the best possible care to the people of Kern County. That concludes my report. I request that the board receive and file, and I'm available for any questions.
Thank you, Mr. Ferris. Anyone in the public? Anyone on the board have thoughts? I have just a concern. That was a very long speech, and I was curious, what is the requirement to read that out publicly each time? Is there a reason why you read that out rather than finding some other way to do that?
I'm supposed to read all of this information into the record publicly.
Okay, fair enough. Fair enough. Thank you, sir. Appreciate it. Any other thoughts? How about a vote?
Mr. Chairman,
Yes.
just as kind of, not as my counsel, but in my, I guess, my quasi-role as a public, is this board or has EMS considered any emergency preparation for the coronavirus? Any of that, has that discussion taken place? That's a,
Yes, there's ongoing meetings are occurring. We are working very closely with disease control. We have been sending out information as we received it to our providers in the field to make sure that they're protected and covered. And we are actively monitoring and effectively preparing, making sure that we have proper equipment in our warehouse, that if need be, we can dispatch that equipment to our providers and to the hospitals.
county council asked me to ask that question.
Great question. I got a comment. That out of your, one of the values of your presentation was you were spot on, but I don't think it's publicly noticed enough about the value and the quality of care that was given to the earthquake, during the earthquake, and how we responded as a county, and how EMS integrated with the whole response for the earthquake response. It was fabulous, and the reason we don't hear enough about it is because it was fabulous. And it was seamless, and it was, I know you've discovered issues, that your interoperability issues, and you're working on those, which I appreciate. But it can't be said enough of how well Kern County came together and responded in a timely fashion to people's need as a result of those earthquakes. So my hat's off to your entire team. Please pass my congrats to all of them.
Thank you, Mr. Chairman.
So I'm looking for a motion to receive and file.
So moved.
Motion? Second. All in favor say aye. Aye. Any opposed? We have nothing for item number 12. Board member announcements. On your initiative, board members may take a brief announcement, a brief report on their own activities. They may ask a question for clarification, make a referral to staff, or take action to have staff place a matter of business on a future agenda. Any board member announcements from anybody? Seeing none, we'll move on to announcements. I have two of them. The next regularly scheduled meeting is Thursday, May 14th at 4 o'clock at the Kern County Public Health Services Department in Bakersfield, California. Second one is deadline for submitting public requests on the next MCAB meeting agenda is Thursday, April 30th, 2020 at 5 o'clock to the Kern County EMS Program Manager. Those are my announcements. Our board member announcements complete. I'm looking for a motion to adjourn.
So moved.
So moved, we're adjourned.